Good morning. Thank you very much for having me here. It's an absolute honor to be here presenting on this topic here today. As per the introductions, I'm a specialist in sports and exercise medicine, musculoskeletal medicine, and also do some work in the Premier League football with Crystal Palace Football Club in England, and also as a Vice Secretary of the ECOSEB, European College of Sport and Exercise Physicians. I was actually speaking to one of the colleagues earlier. I was here only a few weeks ago for another presentation at INSEP, and I'm going to be back here again in a couple of weeks with the NBA Paris, and I was saying I might as well apply for the French citizenship. But looks like I'll spend more time here, which is great. The topic I'm covering today over the next kind of 15-20 minutes is primarily to essentially open the discussion on ACL injuries without going into too much details. Because obviously when I looked at the program earlier, I saw that we've got some really high-level speakers here covering most of the details which are otherwise, essentially covered during the sessions. So this is essentially to give you an overview on ACL injuries, its significance in athletes, and why essentially it is an important topic to cover. So the topics that I'm going to go through today over the next 15 minutes are essentially these. An overview of the injuries, which would include, to some extent, the mechanism of injury. I mean, knowing that will be essentially, extremely important in how we identify the injuries, how we manage, and how we do the rehabilitation afterwards. Then I go through some risk factors. Just quickly touch on Acl Reconstruction. As I said, I'm not going to go through the details of that. It's just to give you an overview of everything. Issues around return to sport and prevention. Now, ACL injuries are very common. So that's the thing to start with. Extremely common. In the United States, the kind of data they give is more than 100 to 120,000 cases per year. And it kind of makes it one of the most, or essentially the most injured ligament in the knee in sports. In football, as you can see, there's some of the figures that I go through, I'm sure you can come up with other research and other evidence with, slight variations. But what I've tried to cover here, or to provide in these slides, is, an average of the figures that are out there. In football, 0.2 for every 1,000 hours in men. And interestingly, just to begin with, straight away we can see that is 3 times more in women. And we're going to have a look at that later on and try to kind of, identify a few reasons behind that. Another interesting finding is that more recently they have identified that the rate is increasing in lower age groups as well. Now that may be because of the kind of earlier age that kids are getting into sports, or earlier age where the sport is becoming more serious for them. And that's probably the reason behind it. So it is extremely important to realize that even in the 5 to 14-year age group, the rates are increasing. And this is all despite our kind of better understanding of everything about it. I mean, obviously, we probably are still far away from fully appreciating the extent of the injury and, the best or optimum kind of management for it. But we have moved really far from the days that, if there was an injury, we really didn't have specific protocols, or, we didn't know the timeline. Things would have been very variable. But we've moved away from that. We have much better knowledge, and despite that, we still see that very common. Now, it is not only common, but also very significant injury. And it's got loads of different short-term and long-term implications to it. In the short term, obviously, in elite sports particularly, you know, the time lost from training, the time lost from match time, from the games, whether or not the return to sport kind of protocols work out really well, and whether or not we can get the player back to the sport. And when they get back to any sport, can they become competitive? Can they compete at the same level as they were before the injury? And obviously, it can be, you know, a financial burden on the clubs, on the teams, on the players as well. I'm sure many of us have seen players in our medical rooms that are just, you know, essentially part of the furniture there. You know, you walk in the medical room, they are there, and, you know, despite whatever you're doing, getting them back out, getting them back into competition can be a real challenge. And the way it plays on their mind as well. I mean, you know, there's significant psychological side effects to a professional athlete who's supposed to perform and just cannot do that. They sat there in the medical room day in, day out, just receiving treatment. In addition to that, we also have the long-term implications of osteoarthritis in the joint. With serious knee injuries, there is up to 6 times increase in the onset of osteoarthritis in the knee. And there's, again, evidence that, you know, within 10 years from an ACL injury, up to 30% there is kind of radiological changes of early osteoarthritis in the knee. And when it goes to 12 years, it's almost 50%. And obviously, these are kind of implications on the long-term quality of life. You know, the thing is, when we are dealing with an athlete, we have to remember that at the same time we are dealing with a person. You know, someone who will eventually retire from that sport, someone who will essentially be looking forward to having a long, active, effective retirement period. And that's where this kind of latter part comes into place. That osteoarthritis can significantly affect that quality of life. As with mechanism of injury, I mean, generally it is divided, classified into subgroups of contact and non-contact. And contact could be a direct contact onto the knee joint during the sporting activity, or any other body part that leads to an injury into the knee. And we have the non-contact, which is essentially, more than anything else, a pivot shift mechanism, a rotational twisting pivot shift type of mechanism. Again, you know, where I started, the difference in rates between female and male athletes, again, kind of similar thing, you know, similar theme continues here. That first-time non-contact ACL injuries are more common in female athletes. You know, the kind of sports that, you know, we can have non-contact injuries, as I say, is primarily around pivot shift and twisting, rotational kind of movements. And I'm sure in your head you can already think of loads of different sports. Football just being one of them, but obviously not the only one. You know, with contact mechanism, you know, it's interesting, just kind of anecdote that from the time it was London Olympics, and I was obviously covering some sports there. We had a contact injury in a wrestler. Now, we would classify that as a contact. How did that work? Well, actually, the opponent went for the athlete's knee and just kept on pulling. And then it gave, he twisted and went down. So mechanisms can be very different. It can be kind of like a traumatic ACL injury even. Now, again, as I said, you know, it is very much around identifying how the ACL is loaded through all these different movements. So we have the element of anterior tibial translation. We've got the knee valgus, all those rotational forces going there. Obviously, you know, as I said, I'm not going to go into details of that. It's just an overview as an opener to the ACL discussion essentially today, that it can be multifactorial. So there are elements that can put the athlete at higher risk of sustaining that injury. And that's apart from aside from the sport that they do. It could be anatomical, structural, and other things that again, we can have a look at a little bit more detail later on. So the sort of, that kind of brings on to some of the risk factors around the injury. The sort of risk factors, one of them, as I said, is the sport itself. So the kind of sports that involve pivoting and twisting, contact, as well as, occasionally jumping. Because as you remember in the previous slide, one of the mechanisms of loading the ACL is through the axial ground force going through the knee that can lead to a secondary anterior, essentially loading of the anterior translation of the tibia. And that is, again, loading the ACL. So in addition to all of these, the sports that involve jumping can also be included. So the list can be, extensive. It is just a few examples there. Now, level of competition is another thing. It is not that clear-cut. Obviously, the higher you are in your sport, the more exposed you are to mechanism of injury. But at the same time, you're more prepared for it. You have got better prehab, you've got better, preparations for that. So, in a way, the only reason we can think of, why, high-level athletes would experience, more injuries is probably just that exposure. But as I said earlier, in the lower age groups, we are seeing increasing rates of the injury as well. Injuries during training versus game or match time. Again, I've seen, conflicting research on that as well. UEFA had done that research that shows during the game time, there is a 20-fold increase in the risk of ACL injury as opposed to training. However, there was another research done in Qatar by Aspetar, and they found the opposite, and they found it's either equal or maybe the other way. Now, one can probably say that's probably, again, to do with the exposure, because obviously in Europe, playing and game time is significantly higher than training. All the various cups and leagues and different things that the number of teams and the number of hours, players are out there on the pitch. So that could probably explain that difference. Tissue properties is another one. Well, I mean, we cannot think about all the ACLs the same as each other. There is some evidence that in people who have suffered ACL injuries, in a kind of a noticeable percentage of them, at least one sibling has had an ACL injury as well. So that kind of makes you think, is there also a genetic predisposition to ACL injury? Is it something to think about? Is it something to explore a bit more on the genotypes that would make you more susceptible to sustaining ACL injuries? So that's kind of, again, as I said, limited evidence on that, but something to think about. I personally, when I do, say, pre-signing medicals and that kind of thing, I go through the family history as well. So I get a full family history on everything, including the knee injuries. ACL fatigue, just another thing to know about. There's been some research on cadaver that kind of repeated stress, repeated strain through the ACL can eventually lead to ACL fatigue, meaning that it's not holding as strong as it should and making you more susceptible to the injury. There are also some other factors, some of which are modifiable, some of which are non-modifiable. I mean, BMI, age, anatomy and biomechanics of the individual athlete. Again, some of them we can modify, some of them we cannot modify. You know, with regards to anatomy, it will probably be the more difficult bit to change. You don't want to do kind of corrective surgery on anyone who you think, you know, anatomically is more predisposed to an injury. But with biomechanics, there is, you know, there's a chance that we can do some stuff to essentially build up on that. And there's more and more kind of focus on the role of central nervous control or neuromuscular control in the movement. That is something that has become obviously, you know, part of most of the preventive kind of programs, protocols that are out there. Because essentially what you can say, an ACL injury could essentially be described as a failure of control. So at some level that neuromuscular control has failed to sustain that position and that stability. And that's something, again, that is becoming a focus of research in the future. Now, continuing with risk factors, obviously we mentioned that in female athletes, first-time non-contact is much more common. Again, you know, as earlier I mentioned, again, the risk in football, in women's football, is again higher. And as I said earlier, up to 3 times. And again, interestingly, if they have sustained one side ACL injury, the risk of having the contralateral or the other side injury in them when they return to sport is still higher than men. Now, there's a whole load of research ongoing about this, trying to identify why this is happening. And these are some of the things that they have come up with. It could be to do with the greater laxity of the knee joint as a baseline. There is a kind of a notion that it may have something to do with the BMI. As we mentioned earlier, BMI could be a relevant issue. Whether or not that applies to everyone, again, that's questionable. But essentially, we know that the body fat ratio to total body mass is higher in female athletes. But again, as I said, this is not something we can really trust as a primary cause for the injury. There's also, some talk about the anatomy, angle of flexion, the Q angle, the knee. There was an MRI-based kind of study that they looked at the knees and they identified that, the medial tibial depth is shallower. But realistically, they couldn't connect that, as far as I know, connect that to the increased rate of injury. But it was, kind of still useful information to know that there are differences in the anatomy at that level as well. And the other thing is about the forces. That there will be a point that a number of different forces kind of top each other up, lead to a force that can lead to the injury. It has been identified in a couple of studies that, concurrent forces or those overlapping forces happen more commonly in female athletes in their movements as opposed to the male athletes. Again, as I said, this is all ongoing research. There's still something that they're working on. ACL reconstruction, well, the majority of athletes who sustain an injury go through that ACL reconstruction. We all know of the research out there that has been based on conservative management of ACL, but we know the majority go through the ACL reconstruction. And in the US, it is about 90% of the athletes that go through that. The idea is to get them back into sport. The idea is to get them back into the sport as quickly, as efficiently as possible to the level that they were before the injury. However, unfortunately, that's not always the case, despite the best efforts, despite the best techniques. And that's something to realize when you want to set expectations for your athlete, you know, and yourself. I mean, it doesn't necessarily mean if you put someone through the surgery, they will be back and they will be the same player again. So in fact, what we have out there, over the first year, about 50% of the athletes after the surgery cannot return to their sports. And you know, those first few months in that first year, when they return, 25% of them can experience a re-injury or a failure of the graft. And you know, in the longer term, however, the results might be a bit better. I mean, longer term return to sports, most of the studies out there are pointing to 80 or more % of athletes managing to return to sport. But again, on average, there's roughly between 50 to 60% of them who return to competitive level of sport. And you know, the risk of re-injury as well is another thing there. There was this kind of 30-year NBA survey there, which again showed more than 85%, 86% of athletes managing to return. But in the long run, they missed a number of games over during their career, and also their kind of career length duration was shorter. I think I'm acutely aware of the time. I think I have to kind of wrap it up. So I just quickly go through this with some of the slides here. So return to sport is again similar to the injury, as I said. It doesn't necessarily always mean that they can return to their competitive levels. The important thing here is that with return to sport, it doesn't finish your care. You have to think about that long-term osteoarthritic changes in the knee as well. The other thing is obviously about prevention. There are loads of, you know, preventative injury prevention programs and protocols out there with good evidence that they can help. With, for example, FIFA 11, it is generally about general knee injuries. However, there were studies specifically for ACL, which have been, again, successful. The important thing is here to be flexible enough to adopt them based on your own sport. And I think we are done now. My last slide would be essentially about the importance of education, both the athletes and the teams there. There's a good kind of evidence out there that many athletes may not comply with what you want them to do. So essentially, you know, in summary, this was all about giving an idea of how common, how significant, and how challenging and complicated ACL injuries can be. Thank you very much.